The health crisis in the country has deepened as the country reported over 5,000 new cases for the second consecutive day. In the wake of the Health Ministry announcing that the country's health system is now on a breaking point, the security has been tightened in the Kathmandu Valley while the government has now imposed prohibitory orders in the most affected 29 districts in the country's fight against the deadlier second wave of COVID-19. Good morning, I'm Sarah Chitrakar and these are the headlines of the hour. The country witnesses over 5,000 new cases for the second consecutive day. 19 more deaths take COVID-19 death tally to 3,298. The government extends prohibitory orders to 29 districts as cases continue to surge. Experts urge the government to use more open spaces to accommodate patients. May Day fails to bring happiness for the working class amid the pandemic. Jobs of an estimated 1.5 billion labours on the line. And Mumbai Indians script a 4-wicket victory over Chennai Super Kings in the nail-biting finish. Pollard steals the show with 33 balls, 87 runs. The security personnel in the Kathmandu Valley have intensified actions against pedestrians, riders and vehicle owners violating the prohibitory orders. The security body has tightened security in the valley, citing the general public's failure in abiding by the security protocol and following the rules imposed for the prohibition period. The police have intensified surveillance on those defying the prohibitory order imposed by the District Administration Office. Various individuals are kept in holding centres while several vehicles are booked for defying the prohibitory orders. The vehicles will be returned after 5 in the evening. The police have informed that restrictions have been eased for hospitals, banks, among other most essential services. Meanwhile, the vehicles of individuals holding identification card and venturing out other than essential work have also been booked. According to the police, the general public is yet to take the situation seriously despite Kathmandu Valley reporting daily rise of around 3,000 coronavirus infection. The government has imposed prohibitions in the most affected 29 districts, including Kathmandu Valley. 19 individuals succumbed to coronavirus in the country yesterday, taking the death tally to 3,298. Meanwhile, 5,706 individuals have tested positive for virus, taking the COVID count tally to 328,893. The present situation has been termed worse than the peak surge of the COVID-19 during the first wave last year. The number of active coronavirus cases in the country now stands at 43,213. The total number of recovery has reached over 282,300 as 1,287 individuals were discharged from various hospitals and quarantine centres yesterday. The Health Ministry has said the rate of infection is spreading at an alarming rate in the most affected 29 districts and has urged the public not to take the situation lightly in any terms. The security has been tightened on the fourth day of the prohibitory order in the Kathmandu Valley. The hospitals in Kathmandu are running out of beds amid a dramatic surge in the number of coronavirus cases. Many patients are unable to reach hospitals amid the current scenario, while some are deprived of medical attention despite reaching hospitals. The government, meanwhile, has been preparing to increase the number of beds to provide effective healthcare to general public. More in this report. The Patan Hospital in capital's Lalitpur is running out of beds allocated for coronavirus patients amid the rise in infection rate. 190 beds allocated for COVID patients have been occupied. The transmission of the virus among health experts and increase in the number of patients needing critical care support has further dented the healthcare system. The hospital administration has informed of difficulty in admitting patients who are in need of emergency treatment amid lack of beds. Various other government, private and community hospitals in the valley are receiving overwhelming number of COVID-19 infected patients. There are 2,468 isolation beds, 241 intensive care units and 107 ventilators in the valley. Meanwhile, the Health Ministry has informed that the number of active cases has reached over 38,000. The health professionals have started feeling helpless as the hospitals are witnessing an overwhelming number of COVID patients. The Health Ministry has already announced that the country's healthcare system is at a breaking point. The government has been making efforts to add 1,000 more beds in the valley and halt outpatient department services. There are now widespread speculations that the countrymen might have to pay a heavy price for the negligence on behalf of the government in taking concrete measures to contain the coronavirus scenario. It was May Day, or the International Labour Day, yesterday. The day, however, failed to bring happiness for the labourers amid the pandemic, as the scenario this year has been worse than last year when the COVID-19 struck the nation. The pandemic has also cast doubt on the employment of an estimated 1.5 billion labourers across the world. We have more news in this report. The Nepali migrant workers had ventured into Indian cities when the COVID-19 subsided some 6 months ago. However, amid the deadlier second wave, all these labourers were forced to return back home. There are an estimated 3 million Nepali nationals working in nations other than India amid fears of the pandemic. The employer companies have stalled the salaries of many of these workers, as informed by the respective embassies. In Nepal itself, the ongoing prohibitory orders placed in at least 25 districts as of Saturday evening has robbed job opportunities of an estimated 900,000 workers, especially working as daily wage labourers and in tourism and service-oriented sectors. The Federation of Construction Contractors has said that only half of a total of 180,000 labourers in the sector are currently employed. Likewise, transport entrepreneurs have said that over half of an estimated 900,000 workers in the sector are jobless. Meanwhile, the government has set up self-contribution-based social security fund for the welfare of this working class. However, only 215,000 employees out of 8 million have been listed with the scheme. There is a general call on the government to look after the countrymen at this crisis time triggered by COVID-19 pandemic. In our Public Voice segment, we had asked in Bhaktapur and Pokhara what should be done to improve creativity of children who have been forced to stay at home due to coronavirus pandemic. Let's take a look at what they had to say.
विद्यार्थीले सिक्नै पर्ने विषयहरू त्यस्ता टेलिभिजनहरू मार्फत पनि जान सकियो भने सबै तहमा रेडियो मार्फत टेलिभिजन मार्फत जान सकियो भने सबै तहमा पुग्छ जस्तो लाग्छ।
जति सक्दो चाहिँ अभिभावकहरू चाहिँ बच्चासँग चाहिँ घुलमिल हुने हैन। अनि अर्को कुरा भनेको चाहिँ बच्चालाई चाहिँ के कुरामा चाहिँ इन्ट्रेस्ट छ के उसको रुचि छ त्यो रुचि अनुसार चाहिँ बच्चाहरूलाई चाहिँ त्यसमा चाहिँ इन्गेज गराउने।
खाना बनाउने ठाउँमा चाहिँ यो हो यसरी बनाइन्छ हैन। उनीहरुले अब खेतबारीतिर अब बाहिर निस्किने परिस्थिति छैन, खेतबारीतिर काम गर्दा त्यो सामानहरू यो हो यसको काम यो हो अनि यो यसरी रोप्ने भनेर त्यो ज्ञानहरू पनि दिन सकिन्छ।
It's time now for our segment Public Pulse, where you text us with your opinion. Here's the question: who should take the lead role for the social security of labourers? Your options are A, the government, B, employers, and C, trade unions. The voting is on. Type NEWS, select your option A, B or C and send it to 34001 to share your opinion with us. That's all for the moment. Thank you for watching. Have a good day.